October may be coming to an end in just a few days, but we're not done recognizing Breast Cancer Awareness Month here at Fox 5. For many women, discovering the cancer can lead to not only harsh treatments, but also losing one or both breasts. Our own Ayesha Khan has been sharing her experience with the disease. She's live in her Fox 5 studios, diving into care after breast cancer. Good morning to you.
Hey there, good morning to you, Maureen. You know, a lot of the care for women, including myself, who have experienced cancer, breast cancer, that includes how we look and feel after those harsh treatments that take a toll not only on our hair, eyelashes, and eyebrows, but also on our breasts. As you know, I had a mastectomy done on my right mastectomy, and eventually I will be doing nipple tattooing. So to talk a little bit more about that and show you an example of what that is Lizeth Alvarado, who specializes in beauty after cancer, and she's been working on this since we last talked with her in our 7 o'clock hour. So Lizeth, what are you doing here?
So I'm creating a 3D areola and nipple tattoo here. I've already mapped the area and recreated the size, and then also color matched. Everyone's skin tone is different, so we did a little bit of color matching. We've got a lot of different tones here. And then, so if you can see, here's what we've done so far since for the last hour.
Does it hurt is the question. For someone who's never had a tattoo before, I mean, what is the pain level for this, and how long after someone who's gone through a mastectomy or even had a reconstruction?
So typically 6 months. It's with approval after the doctor has approved them to come to see me. And then the way that typically women will not feel anything because there's been so much reconstruction, and then it depends on the type of reconstructive surgery that they've had. They may not have any sensation in the area. However, if they do have SENS, I do use a numbing cream. It's topical, so just put it right on top. It's a cream, and then I leave it on for about 15 minutes, and it completely numbs the skin.
Gotcha. Less than 2 minutes here. Can you also talk about some of the other things that are included for women going through cancer? You know, losing the hair and all that, eyelashes and eyebrows. Would you offer something like that as well?
Yeah. So there's scalp micropigmentation, which can also be done with the digital device. This is an example of what has been done on the mannequin. So there's a little bit of balding that can happen because of chemotherapy. And so as you can see with the tattoo machine, we recreate the follicles of the scalp. And that is how we fill in the little gaps in the hair.
So we've got less than a minute left. Can you talk two things? One's about how you say you educate women on how to do this, and second, events that are held geared towards women who are looking for care for beauty after cancer.
Yeah, so I'm a master permanent cosmetic tattoo artist, which I teach a master paramedical tattoo program, and teaching others how to do areola and nipple tattoos, scar camouflage, scalp micropigmentation, as well as getting ready to open up my academy where I can actually teach the fundamentals, which is the primary permanent makeup tattoo artistry. You can do eyebrows and permanent makeup artistry. And some of the events that I have is once a year. This is my first year that I did the Epic Beauty Day of Hope, which was at my office, where we celebrated survivors and thrivers. We had different areas where we had stations where we glammed them with makeup, then prepared them to take photo shoots with a professional photographer with different backdrops so that they could come take photos with their family, friends.
Is this pro bono, or is this something that they pay for?
No, it's
pro bono. Okay.
Yes,
well, the next one that comes up, we'll love to do something about that. I wish we could talk more about this. But Lizeth, thank you so much for joining us this morning. Maureen, we're going to have a lot more on this on our website at fox5dc.com. For now, I'm going to throw it back to you.
Absolutely. And Lizeth, thank you so much for all you do. I know we've covered you in the past. I've been out to your facilities in Virginia. You do an awesome job. Thank you for helping women going through the worst
Maureen
time
says
in
you
their
do an
lives
awesome job.
Feel beautiful and feel good. Thank you, both of you, for this information this morning.
It's a lot coming from you.